fan of the PAETC, so just so you know. So Aunsha Hall-Everett has over 15 years experience in human services and public health with a strong focus on building community empowerment, organizational wellness, and health promotion. Aunsha.
All right. Hello, everyone, and good afternoon. Hope I don't bore you all. I know after lunch we can get tired and things like that. So I'll keep it quick and try to be as energetic as possible. So my name is Aunsha Hall-Everett. I'm actually the Capacity Building Assistance Manager with California Prevention Training Center located in the Bay Area. So I've been there with the agency now for about 2 months. But, it's a lot of learning, a lot of good work that's happening. But the agency has been around for years, and they've actually been a long-term partner for CDC in providing capacity building to agencies across the country. So this time around, the CDC capacity building assistance program is a little bit different. Back in April of 2019, there was CDC awarded 17 organizations, with CAPTC being one of those organizations, to provide capacity building to the HIV workforce across the country. The need to do the capacity building, again, is just to strengthen our capacity to do this work, but also improve our performance measures. As you can see from what's been shared earlier, there's a lot of work that we have to do, and we may not have all the tools to do it, but this is the opportunity for us to begin to look at or explore tools or explore opportunities that allow for us to really make the work for us, right, rather than against us. So with that being said, with the capacity building, it's allowing for us to just enable the HIV workforce to ultimately plan, integrate, implement, and sustain comprehensive programs and services. And it's made up, again, of this 17 organizations, which is our CIBA Provider Network, or CPN. And so there are a few things that we do within the CPN. What we're doing is that we're offering more training options to folks. We want to make sure that the trainings are offered in a different format, and also to folks with different skill levels, that we don't want to say there's one size fit all for all people when we're doing this work. Another thing is around providing more tailored technical assistance. We also understand as we're doing this work that, each of us come with different skill sets. Each of the organizations we work with or jurisdictions have their own particular needs. And so it's good for us to begin to look at ways to customize and tailor our TA approach with these organizations or jurisdictions that we're working with. And another thing is just to really better support like our program managers or our senior managers as they're doing this work. Sometimes when you're in this field and you, as a manager, you may feel like you're by yourself. And this is an opportunity for you to feel supported and for you to also build your capacity. A good way to also prevent staff burnout, because now you're more of a supervisor manager that folks like and maybe want to come to and maybe able to just bounce ideas off of and thought partner with. So again, it affords for that opportunity to happen as well. So more of the makeup or the breakdown of what this looks like now is 4 components under this under this 5-year CIBA cooperative agreement. And so the first one is more of a national training setup. And so we have 3 organizations that are funded under that national training setup. And it's under 2 tracks. The first track is track A, which is more of a electronic type of learning. This is where we can begin to learn as much as we can where we are at our desk or at home, wherever that is, right? And that's actually led by ETR and Associates, which is out in the Bay Area as well, and Health HIV, which is in Washington, D.C. Then we also have track B, which is more classroom learning training center. So again, this is where we come and do the training to you face to face, or you may fly out to go to a particular site and receive that training to help build your capacity. And that's led by Chickatelli and Associates. And again, they're located in D.C. The next one is where we have the regional technical assistance, and I love this one because it allows for our CIBA providers to really work with the various regions and really take on it as based on the needs of each respective jurisdiction. So, and there are different tracks. So with track A under this one, and working with these different regions, and let me just make sure I get this out. The regions are Northeast, South, Midwest, and West. Just want to put that out there. But in regards to the tracks that work with them, there's track A that do more clinical HIV testing and prevention for persons with HIV. Then there's track B, which do more non-clinical HIV testing and also work with prevention with negatives. And then the last one, which is what California Prevention Training Center is funded under, which is track C, in which we do a lot of integrated HIV activities and structural interventions. I heard a question around condom distribution, and we actually are looking to do an institute in the West region, condom distribution as a structural intervention, that we get providers to think more strategically around how to around condom distribution. It's more than just putting a condom in a bowl and just sitting out front and say, hey, grab it. But it's about really working with your non-traditional partners or different venues, and beginning to set up this more a great system across your county, city, or wherever you are to really have folks have access to those condoms. And it helps to build your own program in that sense too. And the last thing I'll just make mention of is that we did jurisdictional assessments, and I think that was brought up earlier. So we did jurisdictional assessments in the West region and got a feel for what are the TA needs for the various jurisdictions in the West, and there were 16 jurisdictions that we worked with. San Francisco County, California Office of AIDS, and LA County were the three in this area that we worked with. And it's a good chance for us to really get a feel for what their TA needs are. We're actually drafting a TA plan. So LA County, you'll be getting that rather soon. San Francisco, we're coming to y'all soon. And California Office of AIDS, you'll be getting yours rather soon as well. But we're drafting these TA plans to send back and see, hey, is this what you need? Is this what we can be able to do, deliver to help you leverage the work that you're already doing? And so just a few of the things that are coming out of these assessments are that there's just more need to see about introducing more home-based testing. I feel like that was already discussed earlier, and it definitely showed a need for why that would definitely help and get us to ending an epidemic. There's also more around data to care and pharmacy data to care, so really engaging the pharmacies, and I really like that piece there, and really looking at how do we begin to see folks who may be losing in care based upon if they are receiving the prescriptions or what have you. Other things are just like more telehealth services. We have some jurisdictions more like in rural settings who feel that this would be a valuable need for them to further engage folks. And another one is more around molecular clustering and outbreak response. I think that's more of a hot topic in this moment. And again, it's getting us to think about how do we better engage communities in which we're trying to do more of this clustering to ensure that we're not to where they don't feel stigmatized or they don't feel isolated or what have you, but we actually allow this to be more of a collaborative and meaningful experience for both the provider and the folks that we're providing services to. So that's us in a nutshell about the capacity building. And yeah, so thank y'all.